Okay.
So, my name's Renee Bullen. I'm Dr. Gross's medical esthetician, and today we're going to walk you through all the different types of acne. So,
Right.
this is going to be very educational. I want you to get a piece of paper, get a pen, because you're going to want to take notes. You're going to learn a lot. The other great thing is this is going to be recorded. So, you'll be able to share it with your friends, your family members, anybody who's suffering from acne. Also, there will be a promo code that I'm going to show you guys right now in your screen. You can see it on your right-hand side, and you can use that all day, and it doesn't expire until midnight. So that's included for everything. All right, so Dr. Gross.
Hi. Hello, everybody. Okay, so these are days we're going to use together to learn, and I'm going to educate you about acne. I understand this is a condition very near and dear to your heart. I have seen over 50,000 acne patients in my career as a dermatologist, as a skin specialist in New York City. I know this is a very challenging condition. The more you know about your skin, the better your skin will look. I'm going to teach you about all these different things, the different types of acne. We're going to talk about what ingredients to look for. Yes, I'm going to talk about our products because they use the science that actually does treat acne. And I want to start by going over some slides. This is like a classroom. Take notes because they're going to be relevant questions you're going to have. We're going to answer them. Okay.
Okay, here we go.
So the first thing I want you to know is that this is the different ways acne can look. Hear me loud and clear right now. The most important thing to know, all acne starts with a blocked pore. A blocked pore is the root of all evil, regardless of what type of acne you have. Knowing what type of acne you have is the next slide. Take a look.
Okay, here we go.
The first thing to know is look at that top left circle. Those are blackheads. Blackheads start every form of acne that looks worse than acne. Blackheads are flat, then blackheads can get infected and red and elevated, but it all starts with a blocked pore. Why that's so important to understand that a blocked pore is the beginning of all acne is because selecting treatments and understanding how to take care of your skin and what to look for starts by knowing that. This is going to give you more education later on the same idea, blocked pore. Look at the lower left. The lower left is also a type of acne, and that's also a blocked pore. Now, you might see these little whiteheads on your face. Here's the key thing I want you to know before we move on. Notice what's missing here in blackheads, what's missing here in whiteheads. The answer is the color red. There's no inflammation, right? That's the huge, big difference between this step and the next step that has inflammation. So let's look at the next slide. Look at these different types of acne in the circles you see. The most important thing to know is number one, we just said it, it's elevated. Look at the fact that it has red in it. What does that mean? It means that there is bacteria there. It means that behind that blocked pore, remember that very first step, acne is a chain of events. It snowballs, it mushrooms, it builds on itself. It goes from one step to the next. So after the blocked pore, you get bacteria trapped. Then you get red, and then you get elevated acne. So look at these slides. Notice some of them are whiteheads that are red. Those are real pimples. That's what most of you have. Then you can see just redness without any whitehead to it, with no bacteria showing, no pus showing. Those are the undergrounders, my patients like to call them, right? They're beneath the skin. They're cysts. They're deeper, okay? And then look at the one on the lower right corner. That's very, very common. Notice something very important. Scars are forming, okay? Next slide. T-zone acne is a type of acne many, many people get. It's a very specific type of acne. We're going to talk about how to treat it. It's important to know your type of acne because when you look at your skin, if you see certain signs I'm going to teach you, you already know blackheads, elevated red bumps. Sometimes those elevated red bumps have a white cap to them, and sometimes they don't, right? But there's redness, elevation, blackheads, T-zone. Acne means your acne is confined, it's limited. You see it only on the T-zone. Very important type of acne. I'm going to tell you right now, here's a big tip. If you have T-zone acne, do not use any hair products that have oil in it.
Yes.
I can tell you I've seen thousands of patients. You're going to use products that will get rid of it, but you can help by starting to reduce the oil that seeps down onto your skin from your hair products. Oil really aggravates acne. Let's move to the next slide. Jawline hormonal acne, always a big problem. Don't worry, we can do things for all types of acne, all skin types. Some people are using acne medicines, we know that. We're going to talk about that. Your skin can be extra red because of them. You might wash too much. It makes redness worse. But jawline hormonal acne, here's the very important take-home message I want you to know. Of course, this gets worse before your period. Of course, this might be the type you also see when you stop birth control pills. Maybe sometimes when you start them, it can become a problem too. Okay? But my point is, here's the big point actually. The acne you see today actually started weeks before with that blocked pore that's already gone because it's progressed to something serious and worse. But you got to remember, my motto, the best treatment for acne is preventing it in the first place. We're going to talk about that. Next slide. And then there's this thing called diffuse acne. Acne everywhere, right? And you might have different types of acne everywhere. You might have just blackheads. You might just have bumps, redness, cysts, right? Those cysts that were the ones that were underground, the ones that were just red bumps, nodules. Sometimes they hurt. They definitely don't feel good when you press on them. And sometimes you can have these pustules, the whiteheads with redness around them, the actual infections, right? It can be anywhere. That's the kind of acne you very much see in people who have a family history. In medicine in general, disorders of any kind can run in families. Yes, acne can run in families. Very often, when you see this type of acne, it means it runs in your family. That's a very important thing to know. And I'm going to tell you why as we move on with this talk, okay? Just file that away. So what type are you? Think about this, right? What are your features? These are horrible pictures because this is a medical slide, folks. This is not meant for the public, but here we are in times that are very different. So I'm going to use the slides I use to teach other doctors in training about acne. I have a clinical position. I will teach my students in dermatology these slides. I want you to just understand that this is a severity of acne that's graded. And it's very important for me to look at somebody and say, you have this type of acne. You have this severity of acne. Because I don't want you to end up in that last slide, the most severe category. Notice the scars that have formed there. Scars are a big problem. We have things that we can do. Okay? This is an example of scars. Even after the acne is long gone in that bottom photograph, you can have indentations in your scars, in your acne areas. Okay? That's the key thing. I'm going to teach you, what does that mean? What are scars? Okay? And what about the brown spots so many people get? They call that scarring too. They're a little different. We're going to go over that. Okay? So, hello.
Hello. Couple things.
I hope that helped.
Very, very insightful.
Good.
And it was
Okay.
there was a lot of buzz in the chat too about when you went over the slide about like how to decide which type of breakouts you actually have. So
Okay.
before we go into the 7 steps of teaching you how to get perfect skin, I have one question about people wanting to know, are cysts that are skin color still cyst? Like say you have that hard feeling, but it's not red.
Got it. The answer is yes, they are. They might not be acne cysts. In fact, I would wonder if that person has that one and only cyst there. Okay. If you have multiple numbers, it's acne cysts. If you have just one, it's a different type.
Okay. And then also, is hormonal acne typically cystic?
You can have hormonal acne, just refers to where you see it and what causes it.
Okay.
The stage it's in can vary from individual to individual. You might just get little pimples. You can get cysts, right? And anything in between. But it's hormonal, comes before your period, comes from different times of things like stopping birth control pills. Sometimes starting them can aggravate that too. We're going to talk more. Ask away though. Okay? Different types can occur here. Go.
2 more questions before we jump into how to actually fix the problem. One is, what about if you're older? Okay. And what about if you're 57 and now you're getting breakouts and you're not even getting your period anymore? But
right.
What's that about?
Okay. It's still hormonal. It's probably related to menopause.
Got
okay. What I say to my patients of that age, and I see lots of people with hormonal acne and that are, because they're going through their changes, the skin hates hormonal fluctuation. That's the main thing, right? And so when your hormones are in flux, even if you're in menopause, it can mess up your oil chemistry, okay? The first step in all acne is a problem with the flow of your own oils, okay? We talked about what's the first step in acne? A blocked pore. It means your oil is too heavy for its own good and it's not flowing. It gets stuck in the pore. This is true for everybody, folks. So you have to understand that sometimes hormones make that change, but there are different things that do. The treatment, the medications, the ingredients used by doctors, dermatologists, skincare companies, my product line in general, all focuses on those things. You got to understand that.
Okay. So I think we should go right into the 7 steps to actually fix the problem. Here's the good stuff.
Right. Okay. We know this is horrible, folks. We get it. We're going to help you.
Yeah. And also, that's the thing too. Dr. Gross is treated, like he said, 50,000 patients with this problem, and it affects you so much personally. And it's such a role on your self-esteem and just like the way you feel about yourself. So we are so serious about this, and this is a big issue for a lot of people, and we're here for you, and we're here to really help this issue.
Right.
So first step that is so important with, like Dr. Gross is saying, with blocked pores is cleansing. Dr. Gross, can you talk a little bit about the 2 different cleansers people can use from?
Hold them up. I want to show you something. There's, first of all, one of them on the right that you see is called the all-in-one cleanser with toner. That's the white bottle. The other bottle is a pump, right? And that's the alpha beta pore perfecting cleanser. Here's the thing. You have to cleanse your skin as the first step, morning and night, to treat your acne, okay? You got to get off that dead skin, that excess buildup, and you got to start keeping your pores open, okay? The 2 cleansers you saw there, the first question to ask if you're looking for, well, which cleanser do I like more? What am I looking for in a cleanser? You know to look, you got to cleanse. Do you want foaming or do you want non-foaming, right? That's the point. These are both cleansers, and in general, this should be what you know about cleansers, but in my case in particular, the white bottle has a built-in toner, but it does not foam. Most people want to just, have a gentle cleanser. It just wipes off. You can use, and I want you to use water to rinse it off, but there's no foaming. So if you have dry skin, sensitive skin, if you're using acne medications like topical gels, like tretinoin, or topical, or clindamycin, all these topicals, sometimes I have patients I know who start to get red from them. If your skin's looking like that, I would recommend a gentle cleanser. If you have really oily skin and you've been using products and your skin is still in balance, right? That's what I'm really saying. Your skin's not red, it doesn't feel tight, doesn't feel uncomfortable. If you don't have that, the foaming cleanser is phenomenal for clearing out pores, right? It foams, right? So you have a choice. You really need a cleanser. It starts the routine off both morning and night, okay? You don't need a toner with either of those cleansers because in both cases, it's built in. And if you use a toner, it can dry you out. Here's why dryness is the enemy, folks. If your skin gets too dry from your products, especially if you're using stuff that doesn't work, you got to switch up, but you got to know that redness, that dryness is the enemy because that's going to prevent you from using products that will clear your acne and help your complexion. But if your skin's too dry, too red, too raw, too uncomfortable, you won't be able to use them. Get the skin back in balance first and choose one of those cleansers is what I think. Go ahead.
Okay, so I've already started steaming, but really quickly, before you talk about the steamer,
Yes.
Can you use both of these cleansers if you actually are on Accutane or you're on an acne medication?
You should,
Okay.
because these are cleansers that are going to really cleanse your skin, but not throw your skin off balance. Accutane's a strong drug, right? There are medications that sound like Accutane that are now generic versions. Your doctors still talk to you about that. If your skin is red and raw, gentle cleanser. If your skin is not, and you're still in the early pimple stages, even with Accutane, that medicine takes 5 months. Months 1, 2, 3, you still can get breakouts, maybe 4 and 5. Alpha beta cleanser. Next question.
Okay, so now we're moving on to steaming. Can you talk a little bit about why this is so important for people who are suffering from breakouts?
Right. Okay. So lots of times when a patient comes into my practice and I look at her, I look at him, I see lots of congestion, lots of blocked pores. Very often in my practice, we go right to a facial as a first step, right? Steaming is a professional treatment. Facials are done by doctors and dermatologists and med spas and clinics all over the country, all over the world for years. Steam is a natural way to start to unplug your pores. I thought it was a shame that people only with acne and complexion problems are getting facials only once a month and paying all this money. So I figured, let's create a steamer that takes 9 minutes. That's what this does. And it's all calibrated. The temperature's thought out. The pressure is thought out. Okay. So it starts to help your skin. And you can do this every single day. Some of the people with some of the best results start with steaming. There's absolutely no better way to start to cleanse and purify your skin than with steam, as long as it's done the right way. It shuts off in 9 minutes by itself. Not too hot. Don't want that. Why? Throws your skin off balance. We know the meaning of that now. Red, raw, tight, uncomfortable, not good. Because then you can't use other products and you'll be limited to how much better you get. So steaming's great, Renee.
Okay. So after we steam, then our face is ready for the next step we want to talk about, which is what you're known for. You're the peel doctor. There's a couple different choices that people have here.
Okay.
One of the ones is the acne eliminating pads.
Like it.
Your
talk about that.
extra. So yeah, who is this for and who are these for?
So I want you to understand something. The alpha beta peel, yes, I invented that. Claim to fame, got it, Hall of Fame for that.
Yeah.
So look, back to my practice and what I know about skin, and now what you know about skin, okay? Peeling your skin the right way with 2 steps in a way that is really the way doctors do it for years. No such thing as a 1-step peel. If you have to have 2 steps. Done the right way and done regularly, it's the most effective way I know to decongest your pores, to stop that buildup from happening. Since that buildup occurs every single day, you get more blockage every single day. I have developed the alpha beta peel to be used every single day. People hear that and think, oh my God, I can't do that. Yes, you can. Because it comes in 3 types. Ultra gentle, the blue one, the blue label. That's the way, if you're starting out, or if your skin's a little bit red, your little skin's a little dry, this is a way to do something every single day, and you should, because it's going to help your pores, it's going to help your breakouts, it goes on to pimples, it goes on to cysts. It is a great treatment for complexion problems, okay? There's one for extra strength. Now, what about if you already use the peels, you know it well, right? This is a great peel. It's strong. Lots of acne people love this one. I will tell you, Renee is nodding her head. She is a medical esthetician. She knows how hasn't seen 50,000, but this lady right in front of you has seen thousands. She's an expert. That's the one she loves. The one in the middle is the orange, right? That's the one that's called the universal. If you're not sure, just get this one, okay? Now, the key thing to this is to use it on a regular basis daily, okay? For those of you who don't know it, it's 2 steps. Take out the packets for me.
Okay.
Okay, please. It's 2 steps like we do in the doctor's office. You simply take out pad number 1, open it up, and apply it. She's not going to do this because she's got her beautiful makeup on, but all over your face, okay? Around and around and around. You never know where your next pimple's coming from. Isn't that the truth?
Quick question. When you are doing this, though, Dr. Gross, can you see more flare-ups when you start peeling after the first couple days?
It's possible. That's good news.
Yep.
It's got to come out, folks. The buildup the buildup you see is not just there on the surface. It goes all the way down to where that oil gland was. Where's that oil gland? Right over the fat layer under the skin, okay? That's deep. The blockage, or that oil is made, it looks like a long and winding road as it goes up to that pore, but it's all this road that it has to travel. You got to clear that. It's good news. Lots of times it happens. Continue to treat. Treat through it. Welcome that sign because it's going to end. I'm listening. Okay, so we talked about pores. We talked about the alpha beta peel. Second step goes on 2 minutes later. Okay, don't wash it off. Apply, apply, apply. Wait 2 minutes. Then you apply the second step. It's the second step in the packet. They stay fresh in those packets. You can travel with them. If you go to the gym, if you want something like as at the end of the day before you go out and you wash your face, you can do a great peel. Your skin is radiant. It is beautiful. This is not just an acne treatment, right? Peels have been done by doctors for beauty, radiance, firming the skin, helping other skin problems. It is a phenomenal product, not just an acne product. Use it once and you will see, okay? But for acne, complexion problems, a must. I'm listening.
Okay, so can you use peels when you are on an acne medication? Like if you're using if you're using
Yes.
Retinol, if you're using Accutane.
Okay, so the answer is you can, okay? If that's the case, then go with the Ultra Gentle. That is the safest bet, the blue label, right? Here's the thing. If your skin is really red and raw, right, because maybe you're over applying it, or maybe you're just suffering from the side effects that are common to these things, right? You always wash and do your peel first. There's a couple things. I am not going to take over the care of your dermatologist, okay? That would be the wrong thing to do. And if they're listening, they appreciate that I'm making that point to their patients who I know I'm talking to, okay? But what you can do is maybe you should start those peels like every other day.
Yeah.
Okay. And maybe you should start to use a little bit less of those products, or take a couple days off, gently cleanse, use the peel, get your skin good to go, or ask your doctor how to integrate them. Okay. I'm sure they'll be a welcome addition because they're so famous, and I'm a doctor and they know about this. Okay. So yes, you should use Ultra Gentle, maybe every other day. Don't overuse your acne products. That makes them throw your skin off balance.
Okay, so can we talk a little bit about the acne eliminating pores, acne eliminating pads, who it's for, and also the one thing that I just want to throw out too, which we haven't really discussed, but I want you to tell a little bit about who should use these on their face, but also remember how I used to use them on my back when I was having the breakouts.
Yes.
If you could talk a little bit about that.
I will. Okay, so everybody, this is the acne eliminating pad. It's not a peel. It's a pad that contains ingredients including acne medications. It is super strong. It is my #1 choice for backne or acne on the chest. I'm recommending that you go with the alpha beta peel we just showed you, the steamer, all these other things. This is the specialty for body acne, the acne eliminating pad. It's one giant pad, so it goes on big surface areas, right? Like your chest, your back. People break out in their butt, okay? Just swab it on areas where you have acne, okay? Or you have little pimples. Or if you know that's an area you're prone to get them, use them every day because it's going to help prevent. It's so strong. I don't think I'm going to make a recommendation to use it on your face. We're not there yet. We'll have future conversations. We can regroup. But for now, everybody, class number 1 today, acne eliminating pads, chest and back, please.
Okay. The next step that's going to be in your regimen is what everybody on this chat wants to know about and is asking because it's just lighting up the chat.
Yes.
And it's about scarring. Okay. And it's about those people that are seeing the scars even after acne, even after, you know.
I know.
So talk a little bit. Let me just show you guys this device, LED, 3 different settings, red, blue. Oh, wait, sorry. Red, blue, and then red and blue. Doctor, please explain this and how this changes the game in scarring.
Okay. What is a scar? A scar is when your acne was so radical that it actually destroyed some of your normal skin. What it really did was it killed the collagen fibers, those proteins in the skin that when the acne was so deep and descended, or you had cysts, or you had undergrounders, or you had really red inflamed acne, it destroyed those fibers so that even after the acne's gone, the skin's indented. Acne scars are indented because of a loss of collagen. This Faceware Pro mask has LED light in it, particularly the red light for scars and the blue light for acne. It's a no-brainer if you want something for acne that I do in my office. LED, for that reason, is done. Like I said, I send people, my patients from my exam room to the facial. From there, they go to the LED room. Now you can do it at home. That's why I did this. The red light stimulates collagen. Incredible. It helps build your collagen. That indentation from loss of those fibers takes time. You will see an improvement because it builds collagen. I can't just say that, okay? This is something cleared by the Food and Drug Administration, by the US government, who evaluates this technology and says, yes, it's legit. To have people know and for me to say it builds collagen because it's such a big deal. So this is going to build your collagen. And this is something that's great for lines and wrinkles. And you can share it with your parents, your mom who wants to look younger. It's incredible. But the red light is collagen. The blue light, acne.
Yep. So a little bit about the blue light. It kills the bacteria. How does that work a little bit?
Okay. You now know so much. We talked about this during that little class session. The first step is that blocked pore, the blackhead, and from there you might get redness, pimples, white caps, cysts. Bacteria is the enemy. The first step, blocked pore. Behind that blockage, you trap an acne called P. acnes. That's the medical term for it. Capital P, period, acne. Okay, bacteria. This light, the blue light, kills P. acne, the bacteria that causes acne. And those bacteria builds up, and it's in a beautiful little place. It's behind that blocked pore, right here. Here's your blocked pore. Your skin's still making oil, feeding those little guys. It's growing, they're populating, they're getting more infected. You go from a little blackhead to a pimple, to a cyst with more redness, more inflammation sets in. Your body's attacking the bacteria. What does that mean? It gets swollen, it gets red. It looks like a little boil, right? That's because you had that bacteria. This LED light, the blue one, kills the P. acne bacteria. Now, that's very important because it can help scars and treat and prevent, okay? This is a phenomenal product. Please tell them about how important it is to use it though.
Okay, so this is again for people, you have to make the commitment to it. You can also see that I'm doing it on my neck. I flipped it upside down in my chin because I tend to get breakouts during my cycle underneath the chin. But this is something you have to commit to 3 minutes a day, every day for 10 weeks. The great thing about it, you guys, is this is a one-time purchase because it's a rechargeable device. if you can see right up here, that's where you're going to plug it in to recharge it. There's a tiny little light up here, and when that blue light is blinking, it means it's time to recharge. The other important thing is sanitation, especially right now. You can easily clean this with a little bit of alcohol and on a cotton and just go right over the actual inside of the mask. So people can share this as long as you're cleaning it in between.
Perfect.
Two things to know that people want to know. Is it safe for all ages? And also, is it safe to use while on acne medications?
Okay. Safe for all ages and safe while you're on acne medications. I use it in my practice for people who are on acne medications. Okay. It's part of the toolkit. Okay. All ages, human skin is human skin. Acne at all ages occurs for the same reasons. It's still the same bacteria. It's still the same blocked oil gland from your own oils being too heavy for its own good and not flowing. This helps with oil issues in the skin too, okay? Absolutely. Now, what I loved about what Renee showed you, hormonal acne, when it's down here, for those of you who have it, you can use it that way and you should, okay? This is the kind of thing where even after your skin clears, I really recommend, I can't say that even if you get good days that you should stop. When you have good days and great days and your skin looks better, I'm not saying we can stop your oil chemistry from having an abnormality, right? This is something that could be running in your family. This could be something true to your system, okay? But this will help prevent breakouts and it can help continue to improve the look of those scars.
So quick question. People want to know, okay, what if I have some dark spots, some pigmentation or freckles? Can I use LED? Is that going to make it worse?
Oh my God, no. Oh, listen, I love that question.
It's going to help.
It's going to help. This is not, LED is not ultraviolet light, okay? Big point. We're here to teach and learn, understand that. You never thought of the difference. You know ultraviolet light is the one that can give you brown spots, it can give you melasma, right? It can cause way worse problems. It's a form of radiation, right? To be true. LED is not. LED was developed by NASA to help with wound healing. The technology was something they then released to the public, okay, to doctors like myself and scientists like myself to create products that can help people. So it's for brown spots, it's not going to make brown spots worse. No way. If it helps with inflammation, if it helps with redness, okay, lots of times things that are red turn brown later, okay? We're going to talk about that with another product coming up. But with something, if this mask helps not let your acne get bad and in fact improves it and you don't get all those red areas, you're going to have less brown areas later.
Okay, this one's a good question.
Yep.
If they use the LED device for 10 weeks straight, is it as efficient as one treatment of CO2 laser?
Oh, goodness. Oh, listen, I mean, to be honest, CO2 laser is like a nuclear bomb, okay? It's big time stuff. It's something that I can't say. I'm a doctor who believes in data, and I'm really going to give you legitimate answers based on science. There's no clinical study ever done that shows how people within one group got CO2 laser and how another group got benefits and improvement from 10 weeks of LED light, okay, or this mask in particular. I can't tell you. I can tell you, you can't get a CO2 laser in your home. Something you can do is you can use proven science, FDA cleared, to build collagen and kill a bacteria that we know is the #1 bacteria that is the culprit in acne. That's what I think people should focus on. It's practical, it's easy to use, kind of fun, and the difference, it changes people's lives.
And then also the one thing I want to point out to you guys too, I've seen in here a couple, you're saying, okay, what about if I just have one random breakout, or I'm not someone who gets acne all the time and I just get that stress-induced pimple or something. We do have something called our spotlight, which has the red and blue light in here, the red light for the inflammation, the blue light to kill the acne that you can actually put on the one spot. So if you're someone that doesn't get, fully. But the great thing about LED, just to point out one other thing with that mask, is it is for wrinkles too. So that's if you're trying to deal with everything, but this is if you do get the random one pimple.
Right. And lots of times people carry that in their purse and they can use that a couple times a day, okay? And the random person, you know, depends on how random. The alpha beta peel, I have lots of patients who use the alpha beta peel and say, it stopped me from getting that random thing. It also, just like the LED mask, helps build collagen, fights lines and wrinkles. The alpha beta peel is one of the most popular products in the United States and around the world by all age groups because it helps make the skin look younger and it gives the skin a big radiance. Now, and if you have acne, it's a good idea to accentuate the positive as well, right? You have beautiful skin somewhere. It makes that more beautiful and it makes all the other areas of your skin look that way. And as your complexion starts to improve and you start to improve the quality of your skin overall, it makes people very happy. And it's really important, I know, it's the bumps that are the biggest problem, right? If makeup goes on and you still see the bumps under your makeup, that's something that you really don't like the most. At least if it's flat, you can cover it. I hear this from my patients. We talk all the time. I have 50,000 conversations, okay? I know this to be true about what's going on out there. These are products, all these products are designed when they're useful for treatment of acne or for complexion problems, are things that help flatten them pretty effectively quickly. That's the first step to feeling better about your skin. And I know that, so I have done it that way.
So the next thing that we're going to talk about is treatment serums. But before we do, one last comment I'll add is to the person in the chat. Yes, LED will help with redness because it does calm inflammation. And also it will help. Someone asked about if it'll help with broken capillaries.
Okay. Well, first of all, about the redness, right? That is part and parcel with the breakout. If you don't have the black pore, you don't have the bacteria, then you're not going to have the redness. Of course it works with the redness. That's the red light setting. My opinion, if you're using this for complexion problems, use the red light and the blue light with the third setting. Get both, okay? You just tap it 3 times and you'll get red and blue light. So that's how I feel about it. Any other did I answer that question?
Yeah, perfect.
Okay.
Okay, so let me try to hold up the 4 choices of serum that you want to use if you're suffering from acne. Okay, so one of them, the retinol, this is only the one for night, but let's start with the day ones. We've got the IPL, which is our intense pigment lifting serum, our pore perfecting, and our C plus collagen.
Right.
So if you are someone with scarring,
yeah,
and you're having the indentations, which one would you recommend, Dr. Gross?
Orange bottle.
Scarring.
Orange bottle. I'll tell you why. Because vitamin C is an incredible ingredient that you use as a serum. So serums are powerful products, right? They're not moisturizers. They're targeted, focused problems. That's what I want you to understand about serums. And I know you're learning about how to use these different treatments. Serums, if you have those indented scars, this is a product that's going to help those scars look so much better. Because vitamin C does what? It helps your skin stimulate more of its own natural collagen production. How crazy. Exactly what I said, those indentations are because you lost those fibers. Vitamin C, and this is a special product though. There's lots of vitamin C's out there. This vitamin C is delivered to your skin in such a way that it really makes a difference on your skin. In addition, what I want you to know about this product is it has ingredients that help that tired look of your skin. Lots of times when you have acne and complexion problems, your skin looks a little dull, looks a little beaten up. This and the alpha beta peel, what a combo, helps people with scars, it helps people with acne, and it gives them radiance.
Okay, next one is I want to know which one of these serums you would use for people who have blackheads.
Blackheads right there, Renee. This is This is a must, I think, if you want a product that's going to work on your pores. Remember, what's the first step in all acnes of all forms, of all severities? A blocked pore, a blocked oil gland. Pores and oil glands is the same thing. The pore is the opening to that oil gland down here, okay? That long and winding road is plugged up. That pore serum, here's my problem with the industry. Everybody was making a product that just helped the pores look better, or it had an ingredient that worked on one issue with regards to why you get pores in the first place. I did the research and found that there's actually 7 different reasons that people get blocked pores. This is a product that has ingredients that address all 7 of the reasons I have identified as leading to a blocked pore. The first step in all the different types of acne, twice a day. This product, so clean, so drying, you can put makeup on over it, moisturizer on, whatever you want, works to prevent and treat those pores, okay? Those pores, they look like they're shrinking. Those pores are going to be addressed. You got to use something. This is made for acne patients and clients.
Okay, next one. Which serum would you choose if you have hyperpigmentation or you have dark spots from maybe a pimple that you picked?
Right. Good. You use the one at the far right. Pick that one up from that one. This is called the IPL Dark Spot Treatment Correcting Serum. People, if you have like brown discoloration, that you see in your breakouts, even if you don't have the breakouts anymore, if you have those white, those brown smudgy looking marks on your face, or if you have patches of brown anywhere, this is a serum that's designed to help even out those uneven skin tones, even out the uneven color. Lots of times that is something you see. It's different from the indentation. Sometimes you have both, maybe you need both. That's your product though. IPL, any brown discoloration.
And I want to brag a little bit about Dr. Gross really quickly in the formulation of this product, because this has been clinically proven to be as effective as 4% hydroquinone with no side effects, okay? And hydroquinone is basically a bleaching agent that you can get prescribed from a doctor, but there are some adverse side effects. And this has been proven to work as much as professional grade. So that's really insane.
Right. Don't like hydroquinone. I think it's harsh. I think it's irritating. I'd much rather use like ingredients in that product, which are forms of vitamin C designed for hyperpigmentation and brown spots, dark spots, even from acne.
And then one other question is, at nighttime, the overnight retinol serum, how can retinol help with people who are suffering from breakouts, scarring, all those types of things?
I'll tell you how retinol works. Okay. Retinol does something it causes an increase in cell turnover. Okay. That means it makes the skin not get plugged up as much. That means because the pores, your pores, even though you think your skin is just uniform up here, your skin actually dips into a little bit into the top of that pore. And if you have increased cell turnover, it's going to work at that target also. Anything that helps clear out a pore, and retinol is known for that. The problem was it was something that was very harsh. And again, I look to ways to make improvements on products that are out there, because as a dermatologist, I know the pitfall and I see the path to doing something better. So this is a product where I took retinol and mixed it with ferulic acid. The one thing retinol in its greatness is it's not an antioxidant. Ferulic acid is. Antioxidants can really help acne conditions look better. Okay, so ferulic and retinol together is the magic combo that makes retinol in that product not so harsh anymore. And that's key, because why? You don't want any redness, but you want to benefit from retinol. It's an idea I think you should consider.
Okay, the next step in the regimen is going to be moisture, and I want you to explain why I chose these two moisturizers for acne.
I did. There's 2 of them, the aqua blue and the white. Okay. The first thing is you gotta choose oil-free moisturizers if you have acne or any complexion problem. Here's why. If oil's getting plugged up and leading to congestion in the pores is the problem, as a dermatologist, I've treated 50,000 acne people. Any external source of oil can make matters worse. Oil-free is a way to hydrate, moisturize, and keep your skin in balance, but you don't have to have oils in them anymore for them to work beautifully. There's two of them. The blue guy uses hyaluronic acid. You've heard of that. You probably heard about this, read about this. That's an ingredient that could hold up to 1,000 times its weight in water in your skin and give it great hydration. And it's something that you find in the skin already. It's the sister to collagen. How crazy, right? I use it in this product because it's oil-free and yet it's beautifully hydrating. This is lightweight and you can layer your makeup on right over it. The next product is a heavier one. This is a heavier one that also contains alpha and beta hydroxy acids. Remember, the alpha beta peel has alpha and beta hydroxy acids. There's a little bit of that in here, not a lot, but it's something that does help a little exfoliation every single day, okay, which is really helpful. And it is something that is a little bit heavier. So you have your choices, whatever sounds better for you. I recommend them both. And remember, whether you buy these or not, the point I want you to remember and learn, you need oil-free moisturizer, okay?
And then another thing that I just want to point out to everybody that's in the chat, yes, you can absolutely layer serums. You just want to, in terms of viscosity, go thinnest to thickest.
Right.
So things like the pore serum and the IPL first before you would go into vitamin C and collagen or retinol at night. And then we're going to move.
Always peel first, though.
Always peel first.
Peel first, and then whatever's lighter. You know, if you have something that drips, it's lighter than a cream that you turn upside down and stays put. So then you would use your peel, your drops, and then your cream.
And the final step of the 7-step regimen, which is one that Dr. Gross would probably tell you is the most important. Let's talk a little bit about this.
Well, here's the deal. Sunscreen is really, really important, okay? The bottom line is that this is something, sunlight now we know can actually aggravate your breakouts because it can make them look a little more brown. It can lead to something called post-inflammatory hyperpigmentation. Sun does that. Especially lots of times, maybe your dermatologist, if you're already on acne products from the doctor, they told you to wear sunscreen too. This is a product that's a strong SPF 50 that people love to use. It's that simple. I know how important it is, but I've seen so many patients. I asked them, are you using your sunscreen? That I hate it. I don't like it. Why? Because it looks white, it looks pasty, it doesn't feel good. I know you got to love your sunscreen in order to use it. This is a hydrating, silky, beautiful, dewy looking product that is also an SPF 50. You won't even know you're wearing a sunscreen, but it's a fantastic, and sometimes it serves even as a moisturizer for some people. It's a great idea. The warm weather is coming, thank goodness, and the sun will be shining, and you're going to be on products. Products can make your skin more sensitive to the sun. Sunscreen's really important. Part of the lessons of this class.
Okay, so a couple of questions, because I know we're really limited on time right now, but I've been reading the questions. We're going to try to get as many as we can. Okay, why is my face red continuously after stopping my acne medication for 10 years? Can this be fixed?
Okay, without seeing you, I don't know for sure. But I can tell you one of two things. Either you're overwashing and over scrubbing your face. I've seen that over and over again. People don't realize that they're using a washcloth. They're using scrubs. I'm not a fan of scrubs, those particles. Don't overwash your face. Don't use very, very hot water, please, okay? I bet you that's part of the story, okay? Because I've seen it many, many times. Or you may have a little something called rosacea. I don't know. And the LED mask is something that I recommend for people with redness in general. And it's something that I really have found to make a huge difference in my practice.
Yep. So the next one is, do you have any guidance on what I should be using for hormonal acne that's starting to come back after I stopped Accutane.
Okay. Yeah. Tough question.
Yeah.
I mean, I'm not doing a virtual medical visit here, but I can tell you, you should go back to your doctor. You obviously have a doctor who prescribed the Accutane, okay? There are certain hormonal problems that Accutane won't address. It can make you look better while you're on it, but if you don't treat the underlying hormonal problem, then I want you to know that that's why it comes back. Accutane just masked it. It didn't treat it. Go back to your doctor and talk about hormones. Talk about something called maybe polycystic ovary disorder, okay? Maybe checking doing a blood test for certain hormones. I would check for DHEAS hormone. Next question.
Next question is, how come I always get a pimple in the same exact spot?
Because that oil gland has something wrong with it. I call it sick oil gland syndrome, right? People just have, from family history, who knows why, one pimple or one cluster. This happens to my daughter, by the way, Liza, who I'm singing downstairs right now, she loves to sing. And that's so nice. Sometimes you get blocked oil glands in one particular area, okay? Because those guys, they have receptors for hormones, for example, that other skin areas don't. We didn't talk about receptors, but sometimes you have islands of skin that's different. In those patches right here, only there do you get what? Those blocked oil glands, right? Those blocked pores, only there. You can treat that, no problem at all. We didn't talk about the sulfur mask.
Oh my goodness.
I love this product.
Okay, so I only have it in the old package. I didn't get the new one yet. But this is our clarifying mask, and it's with sulfur in it. It comes in a tube now for more sustainability, which is something we're focused on. But can you talk a little bit about what sulfur can do as a spot treatment and as a mask?
So thank you for that question, because this is something for anybody who has blocked pores, whether it's in one area or everywhere on their face or certain areas on the face. This is a great spot treatment, like a thin coating. Please remember I said this, thin coating. Sulfur is a medicine that does the opposite of blocking pores. It draws out. You put it on your skin. It says, "Come to me, you blocked pore, oily material inside the pore." It, through a process called osmosis, it brings it out. So at night, if you put a little bit on that patch, that the viewer who had it here, or hormonal acne sufferers, it's a natural occurring ingredient. You don't use too much of it. And if your skin's on the oily side, you can use a little bit under your makeup, a thin coating, just a dusting, and it helps dry out skin all day long.
It's actually my makeup primer. So I usually use a thin layer of it before that's the new package. Yep. Before
Thank you, Carrie.
Yeah. And then one last question, and then I'm going to do a recap on what we just did, you guys.
Okay.
We're almost out of time, but the last question is, how do you boost up to an SPF 50 without using chemical sunscreen?
Okay. I got to tell you, I'm a big believer in physical sunscreen only. I don't like this new published paper by my friend, the Food and Drug Administration, who then saw bad things happen with chemical sunscreens. Physical blocks, titanium dioxide and zinc oxide are the way to go. That's the only one I use. It's in dark spot defense. I've always only formulated with